Today's topic is tracheal collapse. So, what is a tracheal collapse? A tracheal collapse. It's a condition where the cartilage rings of the trachea, windpipe, weaken and become flattened, causing the airway to narrow and making it difficult for air to flow to the lungs. This can lead to a characteristic honking cough, difficulty breathing, and other respiratory distress symptoms. Here's another example of an animation demonstrating the dynamic nature of tracheal collapse. The cervical trachea collapses during inspiration and expands during expiration, while the thoracic trachea expands during inspiration and collapses during expiration. In many dogs with tracheal collapse, the bronchi are also flattened, which can impact treatment and response to treatment. Moreover, it is important not to confuse it with a tracheal malformation, which is a malformation of the cartilaginous rings, as we can see in this image. The blue arrow shows the part where the trachea narrows. The degree of tracheal collapse, or flattening, can be graded from 1 to 4, with 4 being the most severe. In dogs, the trachea most often collapses at the thoracic inlet, where the green arrows are located. This is where the trachea curves to enter the thorax. The causes of tracheal collapse vary. Small breeds, such as toy and miniature dogs, are predisposed to developing this condition, but other breeds can also suffer from it. This disease can be present at birth in a congenital form or develop later in life in an acquired form. In the acquired form, middle-aged or older dogs begin to lose the rigidity of the cartilaginous rings that support the trachea as they age. Clinical signs these patients present with include dry goose honk cough, which is the most common and distinctive sign, difficulty breathing, wheezing, exercise intolerance, and, in severe cases, they can have cyanosis or episodes of fainting or collapse. Other signs these patients may present with include vomiting, retching, or nausea associated with the cough. Loss of appetite and weight loss may also occur. The first step in diagnosing a tracheal collapse is a history and physical examination, which, along with minimal testing, can help diagnose a mild tracheal collapse, while patients with moderate or severe disease may require additional testing. The first recommended test is chest X-rays, which are ideal for assessing tracheal collapse when taken during both inspiration and expiration from the neck to the diaphragm. However, these images can be difficult to obtain and may miss some cases of tracheal collapse. A second test that will help determine the location of tracheal collapse is fluoroscopy, which is used to dynamically assess tracheal collapse. This technique documents the location and severity of the collapse. Nevertheless, fluoroscopy's disadvantages include radiation exposure and limited availability. Another test is endoscopy, also known as tracheoscopy or bronchoscopy, which allows direct visualization of the trachea and bronchi under anesthesia, providing the most accurate assessment of the extent and location of the collapse. Lastly, computed tomography CT is a valuable tool for diagnosing tracheal collapse in dogs, offering detailed images of the trachea and surrounding structures. CT scans can reveal the extent and location of the collapse and determine the best course of treatment. While other methods like tracheoscopy and radiography are also used, CT provides superior visualization of the trachea's internal structure and any associated lung or airway abnormalities. Now for treatment. It is important to maintain proper environmental management that promotes weight loss in obese patients, as excess weight aggravates the condition. It is important to avoid the use of collars that put pressure on the trachea by replacing them with harnesses. It is also important to try to reduce triggers by reducing exposure to irritants such as smoke or allergens, as well as avoiding excitement and stressful situations that can worsen clinical signs. Regarding medical treatment, cough suppressants such as hydrocodone, tramadol, codeine, guaifenesin, codeine syrup, butorphanol, lomotil, diphenoxylate, and atropine are recommended. On the other hand, bronchodilators are probably not effective in treating tracheal collapse, as dogs do not naturally experience bronchospasm. However, a recent study confirmed the benefits of theophylline, so it may be helpful for some dogs. Theophylline or albuterol helps relax and open the airways, promoting diaphragmatic contractility and mucus clearance, and reducing pressure on the trachea. Another factor to manage is the inflammation associated with coughing, for which oral steroids can be especially helpful in patients with tracheal collapse, as well as those with lower respiratory tract diseases such as chronic bronchitis. However, glucocorticoids tend to promote weight gain, so they should be gradually tapered to the lowest effective dose. Some examples include prednisone, prednisolone, and fluticasone, a steroid used in an inhaler with a spacer and which carries a lower risk of side effects. Occasionally, daily sedatives may be necessary to minimize irritation caused by the cough, as well as when the patient arrives with respiratory distress. A short course of antibiotics is also sometimes necessary to treat complicated infections. In severe cases, surgical interventions such as the placement of a tracheal stent or external tracheal rings may be necessary. Some dogs may require lifelong medication to control symptoms, even after surgery. Also, keep in mind that stents may not completely eliminate the cough and may eventually fail, as the metal stent is not as flexible as a normal trachea. In this video, you can see how a stent is placed with the help of a fluoroscope. Here's a table showing the advantages and disadvantages of each